You're watching First Issues. The biggest economies of the world have been brought to a standstill. The busiest highways are empty, and the catastrophic consequences of COVID-19 have been felt at every corner of the globe. The world is facing a fast-changing situation with great uncertainty as the coronavirus, which currently has no cure, has shut down corporates and wiped out informal sector businesses from the streets of all capitals of the world. For now, the only sustainable way to survive this virus is to avoid getting infected. But what sort of lifestyle must one adopt to reduce their chances of getting infected by COVID-19? This is a question we posed to a medical practitioner, Dr. Kiran Bhagat.
One of the commonest questions asked is how, as an individual, can I prepare myself to most effectively prevent or fight this COVID infection besides hand washing, social or physical distancing, and wearing masks. One must remember that this virus has never been seen by the global community prior to its arrival late last year. Therefore, the body's immune system has been unprepared to fight this infection, unlike our annual influenza or flu-like illnesses. Therefore, the herd immunity has not been built up. What we can do as individuals, besides the things we've been talking about on social distancing, hand washing and face masks, is preparing the body. One can do nothing about the virus, but the environment in which the virus attacks can be best prepared by a set of rules that we often talk about. Having understood that the virus is something we have no control over, it is the environment in which the virus sits that we need to modify by appropriately improving our immune system through various mechanisms, including exercise, a dietary approach to boosting the immune system, as well as reducing stress and allowing ourselves to sleep more, as we know that sleep is nature's nurse and boosts the immune system. That the things that depress the immune system are processed foods, particularly high in sugar. We know that sugar is particularly immunosuppressive from a large body of literature that demonstrates this. One simply has to look at what many diabetics succumb to understand the significance of the poisons related to sugar, which are not only found in the sugary foods that we eat, but also in the processed starches that are consumed around the country. We know from current data that the majority of those that succumb fatally to the effects of the coronavirus are those that are elderly and that have chronic diseases. Certainly in Africa, we are not yet prepared in terms of statistics to demonstrate how many people carry chronic disease. But we know in the United States, 6 out of 10 people have chronic diseases such as high blood pressure, diabetes, stroke, and obesity. All of these influence the ability of the virus to spread more rapidly. Now has been one of the greatest and easiest times to form good habits. With social distancing and quarantine, isolation or lockdown, there is much greater ability to emphasize and focus on your health in terms of lifestyle and exercise. Getting enough aerobic exercise, such as 20 minutes daily, whether it's simple walking, jogging, running or skipping, is sufficient to activate various neurohormonal, which means nerve and hormonal changes in the body to improve the immune system to fight infection. Equally, we know that supplementation to the diet, and remember, supplements are to supplement a good diet but not replace a good diet. You cannot replace a bad diet by exercise or by supplementation. But supplements are there because we often cannot afford or have the ability to eat a good portion of fruit and vegetables on a daily basis. The vitamins and minerals that we know improve immune system are particularly studied in China during the corona epidemic last year, and the Chinese have found that large doses of vitamin C, magnesium, zinc, selenium and vitamin D have been supportive in reducing the effects of the coronavirus. Many of these are already found in fruits, nuts and vegetables, but taking these as a supplement may also assist.
As almost half of the globe, including Botswana, has gone in extreme social distancing, which is currently a necessary evil to curb the scourge, what are the possible mental effects of long periods of social distancing and isolation?
The effects of isolation historically, such as prisoners in an isolation cell, demonstrates the effects on the brain of extreme social isolation. And today, with lockdown, quarantine, and social distancing, the effects are going to be felt both now as well as traumatically after the events are over. No doubt, the effects of social distancing, quarantine, and lockdown will have an important effect on reducing the spread of the coronavirus. One must also reflect on the possibility of the adverse effects of particularly the elderly living in isolation for several weeks. These are important matters to consider in the long term, whilst we emphasize the lockdown and social distancing to reduce the epidemic that we are faced with. The consequences must be borne and will definitely be seen after this affair has been done and dusted.